Hi, I'm Dr. Mark Poray, a chiropractor in Whitby, and today we're going to be talking about how chiropractic care can help with headaches. We have an email letter from Natalie in Pickering, and she writes in, "How well does chiropractic work on headaches? I have a pain that is always on one side of my head, and I can't turn my head because it sends pain into my shoulder. Sometimes the pain goes into my eye, and I get blurred vision on the same side as the pain. Is this a migraine like my friends are telling me?" Well, Natalie, I'm going to talk about three kinds of headaches today, and the first is known as a cervicogenic headache. And it sounds very much like, from your description, that this may be what you're suffering from. But without a full examination and history taking, it's impossible to say for certain. Cervicogenic headaches are usually one-sided, not necessarily the same side each time. They can vary from left to right, but each headache will be on one side of your head only. And it's usually accompanied by a decrease in neck motion, as well as pain down into the neck, into the shoulder, and into the arms as well. The pain's not throbbing because it's not a vascular headache, but it will be accompanied by symptoms of nausea, vomiting, or blurred vision. Some of these headaches, as you know, occur in migraines, and that's where some of the confusion occurs. Very often, the symptoms of cervicogenic headaches are caused by some sort of a dysfunction or problem with the neck, and as a result, research seems to bear out that they do respond extremely well to chiropractic care. The second headache is a migraine headache. Like cervicogenic headaches, they're one-sided, but migraine sufferers will testify that they are always on the same side. They're pulsating, and sometimes they're aggravated by physical activity, especially bending over. They may be accompanied by nausea and or vomiting, by light and or sound sensitivity. Migraines can be accompanied by an aura, but not necessarily. Sometimes migraines don't have an aura, so just because it doesn't have an aura does not mean that it's not a migraine. The triggers for migraines will vary from food sensitivities to changes in sleep patterns, like sleeping in on a Saturday. It's sometimes called a letdown migraine. From weather changes to cervicogenic problems. So, in fact, a cervicogenic headache can trigger a migraine headache. So here we see that there does appear to be some sort of a crossover between cervicogenic and migraine headaches. Like cervicogenic headaches, some migraines have been shown to respond extremely well to chiropractic care, and those are the ones that tend to be triggered by cervicogenic problems. The third type of headache is a tension or stress headache. This is the one that everybody knows about. We all, or most of us, will at some point get some sort of a tension or stress headache at least once. These are usually characterized as band-like or bilateral, so they'll occur on both sides of both sides of the head at the same time. So if you've got a headache that is on both sides of your head, or is on the front of your head like a band, then it's probably a stress or a tension headache. The pain has been described as aching or tightening or pressing, and it may last anywhere from 30 minutes to a week. There does appear to be little official research to show that spinal manipulation helps tension headaches, but soft tissue and myofascial work does seem to bring some relief, as does light mobilization. So it should be kept in mind that chiropractic care is not always cracking the neck or manipulation. Your chiropractor can still help even if the manipulation isn't the treatment of choice. The final thing I want to address is how long should you expect these treatments to continue for headaches? Well, the treatment depends on each individual and each individual's chiropractor because the type of care delivered can change the length of time and the intensity of the treatment. But the guidelines laid out by the Canadian Chiropractic Association do suggest the following: that migraines should be treated approximately once to twice per week for about 8 weeks, along with concurrent 45-minute massage treatments to the upper cervical area. Cervicogenic headaches, the ones that Natalie described, should be treated approximately twice per week for about 3 weeks, along with joint mobilization for another 6 weeks. Tension headaches, which we find don't necessarily respond well to manipulation, will respond to soft tissue work and mobilization of the cervical spine, and these have been recommended to be treated approximately twice per week for up to 6 months. Now, I would recommend, if you want to know what kind of headache you've got and whether it will respond well to chiropractic care, that you make an appointment so that we can do a thorough examination and history to diagnose the exact kind of headache that you're suffering from. And then you and I can proceed from that point. I want to thank Natalie now for submitting her question about headaches. It's a very good one, and I hope the answer I gave will help you out somewhat. If you have any questions for me about any health problems, please email me at drporay@gmail.com, or you can check my website for some of the easier answers and a couple of videos on there at www.drporay.com, or you can make an appointment by calling the Brooklin Family Health Centre at 905-655-5767. We also have other complementary approaches to healthcare at the Brooklin Family Health Centre, including homeopathy, acupuncture, massage therapy, and colon hydrotherapy. Thanks very much for your attention today. I'm Dr. Mark Poray, and I'll see you the next time.